Today is the Southern African Development Community's annual Malaria Day, and the Health Department is hosting a webinar to commemorate it. According to the World Health Organization, malaria is one of the biggest killer diseases in sub-Saharan Africa. Jaishree Raman is from the National Institute of Communicable Diseases. She will be part of the webinar and joins us now live via Skype from Johannesburg. A very good morning to you, Jaishree. According to the World Malaria Report that was released by the World Health Organization, malaria cases have decreased, but why is it still of vital importance to continue to inform about malaria?
So you are right, cases have decreased, but they still kill, 500,000 people a year, and Africa still has over 250 million cases a year. So it's still affecting the continent really badly, both in terms of health and well-being and economic output. So it's really important to get rid of a disease that is completely preventable and curable.
So you're going to be part of the webinar. What can one expect?
So we are actually going to talk about what the SADC region is trying to do to get rid of this disease in the country, continent, as well as the SADC region. And we're going to highlight different things that you should do, the research priorities, the treatment, and what the community at large can do to ensure that we can get rid of this disease.
Jaishree, a lot of people might not have, the correct information with regards to malaria and how it is contracted. How is it contracted? Who is more at risk? Are children at risk, or does it just really target anybody, really?
So it targets anybody. And in South Africa, where we've got a very low immunity to it, everyone is at risk. So there's no one can say that because I'm older, I have less risk of getting malaria. So in areas where there's very high burden and people get exposed, the risk is then more among pregnant women and younger children or the elderly. But in South Africa and in Southern Africa, really, everyone is at risk. And how you get malaria is by bitten by a mosquito, a specific species of mosquito, an Anopheles mosquito, that is infected with the malaria parasite. And when it bites you to take the blood, it puts in the parasite into your bloodstream, and that's how you get malaria.
And what are the dangers of malaria? I understand it needs to be treated within 24 hours, or it could have detrimental results.
Well, ideally between 20 or 48 hours, but ideally 24 hours. But if you let it, if you don't get treatment, it can rapidly become very severe, and people can go into coma. And if it gets to that level, most people have a very reduced chances of survival. So it can be very, very, very fatal if not diagnosed and treated rapidly.
All right. So how does one go about preventing it? What are some of the tips maybe that you can give someone who is perhaps going to travel? How do you avoid contracting malaria?
So very much like the COVID at the moment, that everyone's talking about non-pharmaceutical methods, it's the same thing for malaria you can do as well. So if you are going to a high-risk malaria area, make sure that you use anti-malarial protection on yourself if you're going outdoors. Wear long-sleeve shirts, long-sleeve pants, and socks. And also consider taking a chemoprophylactic treatment to ensure that you are protected. So those are really the most important things. And also just know the risk of the area you're going to. So if you're a high-risk area, try to ensure that you are protecting yourself as much and preventing being bitten by mosquitoes. And if you are bitten, make sure that you monitor your symptoms. And if you start feeling fevers, headaches, nausea, joint pain, it could be COVID, but it could be malaria as well. So remember to tell your doctors where you've been so they can also consider malaria.
All right, so that webinar is a little bit later this morning. If you could just give me the details of when it'll be taking place and how one could get involved and participate.
So it's going to be at 9 a.m. and it's going to be on the the National Department of Health web forum. And anybody, it's open to the public. And there is going to be a question and answer. So if you have any questions, just put it into the Zoom question and answer box. And any of us will try to answer your questions.
All right. Thank you very much, Jaishree. We'll leave it there. That is, of course, Jaishree Raman, medical researcher at the National Institute of Communicable Diseases.